We are following breaking news out of Washington today, where our nation's top health agencies are facing widespread layoffs. The Department of Health and Human Services plans to cut up to 10,000 full-time employees.
Now take a look at this video. This was just earlier today. Lines of hundreds of people stretched for blocks outside of an HHS building in Rockville, Maryland. Those are all employees waiting to see if their jobs have been impacted by the cuts. NBC News senior White House correspondent Gabe Gutierrez is following this developing news for us. Gabe, these are people essentially waiting to see if they're employed. I mean, and all of this is coming shortly after Secretary Kennedy publicly vowed to make good on President Trump's promise to shrink the federal workforce. We've heard it over and over again. So which health agencies specifically are being affected?
Hi there, Morgan. Good afternoon. Well, yes, those employees, actually, many of them had actually already been terminated overnight and were going to work and just found out when they showed up that they no longer had a job. Now, this had been expected for several days. The Trump administration has been saying that their goal is to reduce the federal workforce, but this is coming still as a shock to many of those employees. As you said, 10,000 full-time jobs expected to be cut by the Department of Health and Human Services. Among those, including thousands at the CDC, about 2,400 job cuts there. At the FDA, 3,500 job cuts there. At the National Institutes of Health, 1,200 jobs. And at the Centers for Medicare and Medicaid Services, about 300 jobs as well. Just a short time ago at the White House press briefing, Caroline Leavitt said that this was all part of the administration's push to cut the federal bureaucracy and save Americans tax money.
Gabe, let's talk about the ways that this may impact the way the government handles things like disease prevention, research, FDA drug approvals, even public health outreach when we have something like a pandemic. I mean, 10,000 workers, that is a lot of people, right?
Yeah, that's right. And look, HIV treatment as well. Now, the federal officials had been saying that some of these roles, some of these jobs might be folded into another newly created agency, which is now will be called the Administration for Healthy America, or the AHA. But this comes after Robert F. Kennedy Jr., the head of HHS, a short time ago, a couple days ago, over social media, he posted that the administration will eliminate an entire alphabet soup of departments, merging them into that new organization, which I just mentioned. However, as you can imagine, Morgan and Vicki, this is really striking a difficult tone with not just those workers, but also former health officials that say that this could have a dramatic effect on public health. According to a former FDA commissioner who NBC News spoke with, he says that the FDA, as we've known it, is finished, with most of the leaders with institutional knowledge now being let go, and a deep understanding of product development and safety no longer employed. I believe that history will see this as a huge mistake. That's according to a former FDA commissioner. But again, Vicki and Morgan, the Trump administration insists is that this is what Americans voted for, and they want to reduce the federal workforce, and they see it as fulfilling a campaign promise.
Big changes ahead. Gabe Gutierrez, we appreciate it. Thank you very much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app, or follow us on social media.